welcome everybody to our first community conversation. Tonight we're going to be talking about women's health and gun violence, and I'll let our guests on the panel introduce themselves.
I'm Moshae, candidate for district attorney.
I'm Joshua Jones. I'm the youth violence prevention coordinator in the city.
And my name is Nina Ford Johnson, and local pediatrician.
Let's switch microphones. I think this one is better. I want y'all to have the better one. Well, obviously, these are issues that are really big on our mind right now with the election coming up and just in general. So I just want to let each of you guys maybe do like a little bit of an introduction and talk about why these issues, or you can pick an issue why it's so important to you, and maybe a little bit about your work.
Well, my name is Joshua Jones again. I am the youth violence prevention coordinator. For me, I grew up with nothing but women around. I had 4 sisters. My mom, she was a single mother. She raised all of us by herself. I had 3 daughters.
Oh, wow.
And so I'm surrounded by women. And so for me, the topic of women's health is important because these women are instrumental and important in my life. And so whatever I can do as a man, particularly a black man, to advocate for the rights of women from the health perspective or any perspective, I want to be at the forefront of that movement. But when it comes to gun violence, as the youth violence prevention coordinator here in the city of Mobile, it's my job. It's my everyday. I wake up, I hear about it. I go to sleep, I hear about it. And if I'm asleep, somebody's gonna wake me up and tell me they heard something about it. So, but when it comes to gun violence, I think it's important that we start reshaping our perspective on the way that we approach gun violence. Right? It's not an enforcement approach anymore. We got to look at gun violence in the ways that we treat it from a public health standpoint. And I think we will start pulling together those entities and those organizations that focus, on the science behind ways that we can prevent gun violence. I think we would then begin to see, a decrease, a drastic decrease in the cases surrounding gun violence.
Oh, Mr. Jones, that was so good, and I'm so glad I think you just came to the city to do this job.
Yes, ma'am. Yes, ma'am.
Well, we are so blessed to have you here. And I really like how you linked it as a public health issue, because it 1000% is. From what I see in the practice and from what I've been hearing from other pediatricians across the country and what they've been seeing in their ER visits and in the clinical setting in our offices, this is such a problem. And not only is it a problem for the children, we talk about a physical problem, like in terms of like the gunshot wounds and the violence and stuff like that, but also a mental health anxiety issue. And then it really hit home for me when about a month ago, my husband and I were out, and we got a phone call from the woman who helps take care of our children, and says, I just received a phone call that my son was shot and now he's deceased. And now, so I'm working with her through her grieving process. And it was so traumatic. And I was like, my heart was so heavy for so long. And I'm like, this is her son, and then actually having to see him, because we were wondering, like, could this actually be an open viewing because of the location where he was shot, and how senseless the violence was. Like, it was so unnecessary. And then we found out the alleged perpetrator is just like fresh out of high school. And now we're carrying this grief, and yet we still have to work, right? We can't we can't lay down on our laurels. So we still have to figure out ways to make it through and still grieve during the same time. And I really wish that gun violence in our community could be seen as an epidemic, as a pandemic, just like fentanyl overdoses. Right. Just like those parents are grieving for those lost children, because we grieve for them too, we also need to grieve that same grief like we have for parents who lose children to gun violence.
Just piggybacking off what you said about changing the way that we look at gun violence, I think too that we have to talk to young people and really ask them, why do you have guns? If you ask like a young kid from an urban community, why do you have a gun? They'll tell you for the most part, because everybody else has a gun. Because if I don't have a gun, then I put myself at risk of not being able to protect myself. And I think just systemically, we have to look at these root causes to understand, why do our children feel like they have to have guns, and why are they able to access guns so easily? And so I, have a different mindset when it comes to running for DA, being tough on crime and having this tough enforcement mindset. All of that is well and good, but we can't bring dead children back. A few months ago, LaQuentin, who is the same age as my son, was killed in RV, and that was a little boy that I used to pick up when he was 11 months old, 12 months old. I used to pick him up so him and Corey could play together, because they both were only kids. Corey's my only son, and Quentin was Quita's only son, and I used to pick him up sometimes. So to know that this 6th grader who was just about to go to one of these homecoming dances, had just gotten his ears pierced, he didn't own a gun, but he was in an environment where guns were rampant, and he was hit by a stray bullet. And so when you talk about preventing gun violence or reducing crime, we have to think about what happens before the gun is shot, because they've arrested 5 people now for his murder, but we still can't get Quinn back. So we do have to change our approach when it comes to being proactive, being preventative, meeting kids where they are, and that's why, I applaud the work that you do with community engagement and getting proximate. We can't continue to airdrop solutions on communities and neighborhoods in hopes that will resolve these issues, because you don't really know how people live until you get to them, until you get in their communities. And so we do have to take the gloves off and link arms with people to help resolve these issues, because regardless of how people live, socioeconomic status, or educational level, or whatever, everybody wants to feel safe.
One of the things that I've seen in the little bit of community work that I've done with Strickland Youth Center is that no matter what neighborhood that you see the kids coming from, what color they are, to me it seems to be the underlying cause is always poverty. Every single time it's poverty. So what are some solutions that you guys think are some policies that we should be trying to institute to tackle that and maybe give kids another choice?
That's really heavy in terms of the poverty issue. And I know from a pediatrician standpoint, I think strengthening our background checks, I think, is key in terms of making it necessary for people who sell guns online and those unlicensed dealers to make them go through background checks. I think that would be key. Let's see. Oh, banning assault weapons. One of my kids, and I hope the family is listening. They may be listening. They have an AK-47, and they shot an animal with it. And the child was holding holding the AK after she shot after hunting. And I was like, I don't think that's necessary. That scared me so, and I can still see that in my mind. So that's really frightening. So I don't think in times of if you're in Iraq or whatever, I think that's cool. But in Mobile, I don't think that's necessary. And then some things I talk about with parents and that I need to do a better job of is that every well check, starting at the age of 3, I ask, do they own firearms? And they tell me yes, and I'm like, well, they say, oh, it's put up, And I need to go further detail, because put up is not enough. Because if you know my kids, whatever can be put up can be put down, right? They're going to find it. And so let's talk about other ways we can safely handle the guns that we do have. A poverty issue is very, very difficult. And maybe Moshae or somebody else can answer that from a better perspective, but I don't know if I have the answer to that.
I'm just kidding. So I will speak on it. I'm always one, whenever I try to put something out there, I try to use either a past situation or some kind of narrative or parable. I'm not Jesus, but the parable, if you so will, but this is fact. When we looked at automobile accidents, I would say decades ago.
Sure.
And how many fatalities we were having a year with automobile accidents, and they changed the way that they approached it. Dr. William Hatton, I think that's his name, was the one that did the standard public health approach to solving the issues surrounding automobile accidents. And what followed was a change in policy, change in legislature, a change in the engineering of the vehicles, the change in the demands and how the vehicles were made. They were made to be more safe. All of this changed after we started looking at the issue from a public health standpoint and allowing the experts to apply the science behind it. But what was interesting after that was not only did the demand to be safer change, the way that we view automobiles, the way that we view the practices, the way that we drove, the way that we were expected to drive, all of that changed because of the new science that was presented, the information that was presented, the demand that was presented. And so when we look at gun violence in general, there needs to be, of course, a change in the way that we view it. But with that change will come the new policies and the legislature to follow, which when we look at gun violence in general, the root and underlying cause is poverty. So we got to go back into these communities. We got to connect these people to the resources. And a lot of times, these individuals are suffering from what I call just straight crisis mode. They operate in crisis mode. They can't take advantage of what is available because they can't think past right now. And so we got to be able to connect them to the right resources, get them back to baseline. Homeostasis, that's for y'all science. Get them back to homeostasis so that they can operate at that level in which they can start taking advantages of what's available to them. But until we change the way that we look at this issue, we change the way that we approach this issue, we will continue to go with that.
Yeah, I agree. One thing I always try to think about when I would deal with those kids is there's nothing I would do to feed my daughter. So if I had to, she turned to a life of crime to make sure she wasn't starving, like how can you judge people for that? So what kind of policies does he needs to do to help people feel like they have a choice? Moshae?
And I think too, as a community, I don't know who came up with this thing. I know that the city says it a lot, and I've made a poster that says it takes all of us. It really does. I think we have to stand in the gaps. When I was a teacher, the slogan for Mobile County Public Schools was, it starts with us. And I just thought that was really misplaced because it put this responsibility on educators to be, the parent, the social worker, the doctor, the chef for these children who have so many needs. And it takes all of us being engaged with the community. Even when I was a teacher, I would leave the school and I would see my kids, after school, because maybe I was there for like an hour working on some stuff. And I would leave the school and they changed into their play clothes or whatever, and they're just walking around like doing nothing. There was not a rec center for them to go to or a Boys and Girls Club, and they were idle and they were out. I'm like, what are y'all doing? Put those rocks down or whatever the case may be. But because they did not have, those other options or mentors like I did, the Boys and Girls Club was right around the corner from my house, and I lived there. I mean, as soon as school was out, I would race to the Boys and Girls Club because that was much better than the reality that was my home life. I would have rather be anywhere than to be at home. And so for a lot of children who don't have any other option but home, where they're mistreated, where they may be hungry, where they may not have support, or they just may be raising themselves, we can see these sort of parallels that run with poverty, like illiteracy and youth violence emerging at younger and younger ages, children showing up at Strickland Youth Center at age 8 and 7. And so I think that we have a responsibility as community members to place ourselves in spaces where we may not live. We can get so comfortable in our bubbles where our children go to, amazing schools and have amazing aftercare programs and amazing extracurricular activities, and we kind of don't get outside of that until we go into other spaces where other people live, and we see they need us. And when we work together, when we put ourselves in those spaces, we are better and stronger together. Now, as far as poverty is concerned, I don't know that I have an answer for that either, because there are so many factors that contribute to poverty, and some of it is financial poverty, some of it is educational poverty, some of it is a poverty mindset that is generational. And there are some factors at play from a government level that have contributed to that. And so when we do take up those spaces as leaders in our community, we can reconcile the disparities that have been perpetuated by the system as we are able to occupy those spaces as new agents of the system, as I will if I become the new district attorney. So.
I think you might have a question.
So I have a question, and I want to explain why this topic is so near and dear to me. My mother was a victim of gun violence. She was actually killed by my stepfather with her own gun. And then my brother was also shot. He was a child. He survived. But he was shot by a friend and hurt his leg. But I feel like a lot of times these cycles of gun violence happen generationally. And we're breaking the cycle. I mean, we talked about poverty, but I'm also wondering what you all, and you also talked about legislation that would change the way people are able to acquire guns, but I want to know what y'all think about gun safety education as a way to prevent gun violence.
I'll just respond quickly. I think that we have to hurry up and implement some very aggressive gun safety measures like right now because of the permitless carry legislation that is coming. I mean, for me, and maybe this is just I don't think I'm imagining this, I see us turning into the Wild Wild West, because there will just be no sort of safety measures in check to see. It's different when you have to go down and get a permit to carry a gun, but now if you can have a gun anywhere, you can carry it, you can conceal it or whatever, as long as, maybe a private company that you're entering has restricted that, but pretty much everybody will be able to have a weapon. And so we do have, right now, like yesterday, type of responsibility to make sure that we are educating people and even our children on gun safety, because it may not just be that, well, like you say, it's put up, I've safeguarded mine, but what about when my son goes over a relative's home or a friend's house, and now there are so many guns, anybody can have a weapon, and we have people around guns who are either afraid or think it's a game. And so, cynically, I suspect that we will see an uptick in gun-related accidents, and law enforcement agencies, especially since this is legislation. A lot of our law enforcement officers and leaders, they oppose that legislation because they understand the danger of it, but we're going to have to make sure that people understand gun safety, to your point, and that's not just from a government perspective, that's on a school level, that's on a church level, on a civic level. We're all going to have to make sure that children especially understand the danger and risk of guns.
So do you think like public school, pediatrician office, are these places that gun safety should be a topic?
I do, because as they both said, I do believe that it is a public safety and a health issue, especially so at every level, whether public, private, medical, educational, all of these different entities and different subsectors in our community, we all have a responsibility to keep us and our children and other community members safe.
And also, how can we, and I don't mean to keep you going, but how can we push for that?
I think by having these conversations now, I mean, not everybody is going to share our sentiments about like this is a right now emergency type issue. They're not even thinking about the fact that this is coming by the end of this year. And so, it's going to take, like when I was in, just using my personal experience, Connect Mobile, we had a project about autism awareness and making sure that parents could watch out. And I know it's not related, but I'm just talking about the approach. We met with and interacted with 90 different doctors and pediatricians to give them some information like, hey, we're providing this packet. Can you talk to your parents about X, Y, and Z? And I see it being, you know, as the same approach for those of us that are cognizant and worried about what is to come. I think we as community members have to impress upon the doctors that serve our children, or the doctors that serve us, or our children's teachers. Are you talking about gun violence at this school? Because my son is here and this is a responsibility that we all carry. I don't think that anybody is coming, you know, to say, we're gonna have a universal push for gun safety in Mobile, Alabama. Like, I just don't see that happening. We're gonna have to be the ambassadors of gun safety ourselves.
I grew up in a law enforcement family, and there were guns everywhere, and it's hard to get the adults to listen. So I think it would be smart to start with the schools, because you know, say with my parents, they might not listen to me, but they'll listen to Charlie. And everybody was amazed. We went took her to my uncle's honey camp, and never returned because they thought it was okay for there to just be guns laying everywhere and to tell a toddler not to touch them. It's just not good enough, so we never went back. But I think in the school safety and, you know, in the DA's office, head up creating some of that to push out to the school. If we have the right person here.
You know, I find it interesting, you know, that you brought that point up is about, you know, how can we advocate for, you know, change in policies, you know, the right to bear arms, you know, when we talk about this issue, it's so close to, you know, our constitutional rights, right? And so that it gets really touchy. It gets really touchy when you speak about that, right? But one thing that I was having a conversation with a group of individuals a couple of weeks ago, and I was like, you know, but what about our inalienable rights, right? Life, liberty, pursuit of happiness. But that first one is life, right? You know, do we take this right to bear arms, you know, and do we place that above our basic right to live? You know, is it that more? So we gotta change once again. We gotta change the way we look at it. I know y'all like, okay, you said that like 40 times, Mr. Jones, but we really have to change the way that we look at it. We gotta humanize the issue. You know, when you look at the point that Laura said, when you look at the young individuals that were lost, we have to put names to these faces. We have to humanize this issue. We gotta make it real. And we need to put people in positions that understand that have walked these streets, that, you know, have embraced the moms that are crying, you know, that are standing next to them at the funerals, you know, that are going with them in the hospitals when they're being treated for these gunshot wounds, and trying to connect them to the necessary resources so that there's no retaliatory action. You know, all of this, you know, it's a culmination of all of that, and we need people, you know, who are passionate enough to be able to stand on that side of the line as champion for the right to life, you know, and you know, I find myself between a rock and a hard place. But one thing that I do know is when I look at the little, you know, the young minds, the children, the youth, you know, in this building, outside in these streets, in these schools, you know, for me, it's a no-brainer. So it's going to take all of us. You know, it's going to take all of us. You know, so
I was going to just tell you, Ms. Agnew, right, that you will be the one to break that generational cycle in your family. And because you're being vocal about it, and because you're so passionate, that same passion and energy that's in you will also be in your children. And so it'll stop. And that same passion that you have that brings you here tonight, you could be anywhere else, right? You can forward that to run for school board, and that supports you and help you with your campaign, right? Because you're the type of people who we need to speak for us, to speak for our children. Because that's one of the main reasons why I became a pediatrician, because children don't vote, so they need somebody to speak for them. So that's what my goal, that's what my mission is. And because you are so passionate about what you believe in, I propel you for you and empower you for you to go forth. Because now you will break the cycle in your family, so it stops with you. And in terms of, I told my husband like how they do like an autopsy with someone when someone dies. We need to do a psychological, a sociological autopsy for that child when that child dies. Is there a church nearby? What kind of school is nearby? Do they have sidewalks, right? do they feel safe? Can they go outside and go for a walk, right? Is there a store nearby? A grocery store? We think that's so silly. There are places in Mobile, Maysville and one, that there's hardly no grocery stores for kids to eat healthy foods. What else? Is there a Boys and Girls Club nearby? So if we do a sociological autopsy of where that child lived in that community, and we see, okay, what resources are missing, then we can pour what's going on there, pour it into that community, what we have in other communities, we can pour it in there and thereby build up that child's village.
And help them feel hopeful. Hopelessness is one of the biggest problems
Homelessness.
in our communities across the board.
That's correct.
So obviously we're here to talk about women's health as well, and abortion is something that that's on all of our minds right now.
Yes.
I am very pro-choice,
Sure.
and I've been incredibly worried about everything that's going on, but I would definitely love to hear from you, Dr. Ford Johnson, because as a pediatrician,
Right.
and also the first lady of a church in town,
Yes.
I know you have a lot to say about the issue.
Yeah. It was really disheartening to me when Roe versus Wade was overturned. And I say that because the United States has a history of telling women what to do with their bodies. And I think about the forced abortions, or the Mississippi abortions that they call them, that occurred back in the 60s and the 70s, when they told a black woman or a disadvantaged poor white woman, like, hey, you're gonna go for surgery, or like my Shiro, Fannie Lou Hamer, right? She went to have surgery, they thought, she had a tumor or a mass, and they end up removing her uterus without even telling, right? And so this happened throughout our country, and people telling us how we should do our bodies. We think about the father of gynecology, who, J. Marion Sims, who had a statue placed in Montgomery and in New York, right? The modern father of gynecology. Well, he practiced like over 30 procedures on his slaves with no anesthesia. So that's the history of our country, of people controlling women and telling them what to do with their bodies. And I think it should be left up to a woman's choice with her and her doctor, her faith. Me personally, I have never been in a spot where I needed to have an abortion, thank God. But I still think it's dangerous to take that away from a woman when we have our history that dictates what we have in the past, what has happened to us. And that's what really had me sad.
Well, I have had an abortion, and I grew up here. I lived in California for a while, and women openly talked about it. It wasn't something that you had to be ashamed about. But when I decided to come out and say that I had here, I was scared. Like, we installed security cameras on our house. Like, I had a breakdown because I knew it was going to impact my business and my life because of the judgment that people face. And so I was worried about people finding out for that reason, but not because I'm ashamed. I did nothing wrong. I've never regretted it. And it made me really scared to live here and to take those choices away, from all of our daughters.
Wow. Yeah. And that's sad that you have to feel frightened because of that. And it should be no condemnation. And we're in a church here. Jesus Christ said, with loving kindness have I drawn thee. Not with condemnation, not with anger, not with fear, not with judgment. He said, but with loving kindness. But some people, maybe they tore that out of their Bible. But
I think it's important, and I'm just being an example real quick. I think it's important for men to know when to step out of the conversation. I refuse to be a part of an organization that makes decisions on behalf of the community that's not present at the table, right? particularly when it has nothing to do with me. And I feel like men, at some point, we got to be able to take a back seat to issues that have absolutely nothing to do with us. Prime example.
It just really makes me angry that there are so many proud, pro-life people in Alabama, men and women, when, that's a lie, really. Because when you look at how we rank when it comes to maternal mortality rates for Black women, when you look at how we rank for gun violence, when you look at where we rank for suicide, when you look at where we rank for mental health access, 50 out of 51 states and territories, when you look at our poverty levels, when you look at our literacy rates, we are not pro-life. We are pro-control of women. And so there are just so many inconsistencies when you talk to these people about being pro-life and they have a stance on abortion, but a crazier stance on what it means to feed a hungry child, or what it means to be in support of the death penalty, or other very alive principles that had to do with people who are walking around and talking today, not wanting to be proximate to the same babies that they, like to save in theory. And so, I have my own beliefs. I don't know if it's appropriate to discuss here about what this is really about, but it is not about, saving embryos. I think people need to be really honest about what they're fighting for, or what they're fighting against. And so, for me as a woman living in Alabama, I say all the time, this is a dangerous place to be Black and female. Because of our laws, because of the number and percentage of Black women that die in labor, because of the policies that hospitals implement when it comes to, do we save the baby or do we save the mom, and how that works out when you are a woman of color. And so, honestly, there are lots of thoughts and conversations that people like myself have about leaving Alabama because of what it is, what it means to be here and to be a woman and to be living under a regime that not only has criminalized abortions, but has also pseudo-reprimanded me as a candidate for saying that I stand with women, and that as a new district attorney, I would exercise prosecutorial discretion when it comes to enforcing this abortion ban, that I stand with nearly 100 prosecutors across the nation who have decided to put their resources, both financial and personnel resources, elsewhere, maybe towards these doubling homicide rates, maybe towards the uptick in youth violence, maybe towards prosecuting murders faster so that people who kill folks don't have to sit in jail for long amounts of time. Maybe they didn't do it, or if they did do it and they're out on bond, the victim's family doesn't have to face this person for years and years and consider getting their own form of justice. So there are so many other things that we can do with these limited taxpayer dollars than to criminalize doctors and women who want to make decisions that are best for them for whatever reason. I am completely pro-choice and stand with women when it comes to abortion. We've seen so many different situations play out just lately across the nation where children who have been violated or have been victims of incest or molestation or rape have had to cross state lines to go and have an abortion and are hunted down by public servants who have been elected or put in position to keep those same people safe. Victims who are seeking out abortions from other states are being hunted down by their own elected officials. So we have some real work to do in Alabama, and as long as we do not do the work of electing the right people to enact purposeful legislation and people who are going to make policy decisions that make sense on behalf of women, we'll continue to go down this road.
And another thing we can ask for, if we want our mothers to be safe, and we are, let's expand Medicaid for all. Like, why are we still having this conversation in Alabama? That should have been done. right? And so because we don't have Medicaid expansion for all, which would help with poverty, it would give those children and it would give those adults the insurance and stuff that they need. So now you don't have a lot of rural hospitals anymore. People are traveling 1 or 2 hours to come to have their baby, which is so dangerous. It is so very dangerous to be a woman pregnant, like you said, a Black woman pregnant in Alabama. I think about the doctor, her name slips my mind, who was from Alabama, but then was a pediatric resident in Indiana. And she still died as a Black woman having a baby. And I'm like, how is that possible? She's in a whole other state as a physician, but even she's from Alabama. But it's just, I don't know, it's just something, to be a Black woman and to be pregnant, I tell them it's the most dangerous thing. And that's why I'm always on top of my moms to make sure they're okay. I'm like, hey, you look pale, you need to go back to your doctor, you need to start taking some iron. And they go to the hospital and they're like, oh, Dr. Johnson, thank you. I was admitted for another 2 or 3 days because my blood pressure was through the roof and all this other stuff, and that should not be. So Medicaid expansion for all, that's something that I think we can push for our legislators since they have enacted this law. That way they can provide cushion, but I don't know if that's going to happen or not.
I have 2 questions for you, Dr. Johnson. One is we've seen already women across the country with wanted pregnancies who've been forced to accept it and lose their uteruses. Have you heard of anything like that in Alabama? And what are some of your concerns? Because that doesn't seem very pro-life to me, to make women who want to have children lose their uteruses while having them born their babies.
Yeah, I haven't seen anything like that at all. And it's, like I said, it's so dangerous for a woman who is pregnant because anything can go wrong. And so that's why it's so important, one, to establish, insurance, so expand the Medicaid, develop those rural hospitals, or attract talent. So we have Mr. Jones here, we have Moshae down here. These are young people who are active in our communities, who are go-getters, who our children need to see. That's what would curb gun violence to me. Like, oh, if they could do it, so could I. But if we don't allow them to I guess, manifest their God-given talents and abilities, then who do they have to see? Then there goes the hopelessness cycle all over again. And so we have to keep our talent here and attract it and keep it like Moshae and like Joshua and Charlie and Corey, okay? We can't afford them to leave. And that's why I preach so much to like these college students and these medical students here at South and so forth. I'm like, you guys are getting great education, and if you want to go somewhere and do residency or do something else, but you got to come back. Because our children need to see you here, they need to see you working. That way, that'll motivate them to say, okay, if they can do it, I can do it too. That's why it's so key to keep Moshae and have her be elected as DA, and keep Joshua and have him one day be mayor. I don't know. But I mean, whatever God says and allows, so be it.
My other question, and any of y'all can take this, is as a white woman, what can I do to help, or is there anything that I can do besides obviously voting, to help educate other people about some of these issues, or what can I do to help to solve some of these?
I just had a real funny flashback to a scene in Malcolm X.
No.
I want to watch the movie now and figure out.
Well, there's a scene where there's a white woman who asked him the same question in the movie. But anyway, I've had this question, be asked of me by friends of mine who are white women and white men too. Like, what can I do? And I always say, and it's weird answering your question because it doesn't apply to you, but I always say that people should talk to the folks that I don't get to talk to. Like, when you are having Christmas dinner and Thanksgiving dinner, and you have an uncle or a grandma or an aunt or whomever that, they say racist, hurtful things, and it's just easier for you to just ignore it because you don't have to see them again for the rest of the year. Like, you don't have to speak truth in that moment because it's just so convenient to ignore it and get on with the holiday. Like, you don't want to be that family member because you want to be loved and accepted. I challenge people in those moments to stand up, you know, in those spaces. I will never, I don't say never, but it's very unlikely that I would have Thanksgiving dinner or Christmas dinner with, you know, your family member who may not appreciate me because I'm a Black woman just off the color of my skin, but you do. And you have to be the voice of reason and of love and of calling them out, like the voice of accountability in those spaces, because those are the people that, you know, are pressing this pro-life and this, you know, we gotta have our guns. Like, these are the people that are going crazy on my Facebook page right now, you know, in the comments telling me that I don't have a right to run for district attorney, or, you know, because I'm not a conservative, I shouldn't be in that position, or, you know, what have you. These are the people that I would not normally come into contact with on a day-to-day basis, because we all live in our bubbles, right? School, church, work, home. And so when you have access to those people who are, you know, tangentially more on the extreme than what we are willing to discourse about in public, I just charge my white friends and family to hold their family members and their friends accountable when they say the things that they wouldn't say in public.
That's great advice, and also great advice for men with misogyny to speak up, because I know so often that men are laughing at the rape jokes when they're really just not funny.
And you know, just I go take Corey to the barbershop about once a week, and I can't say this for his current barbershop because it's a very respectful environment. But other barbershops that I've been to throughout his life, there is just a lack of accountability with men. Like, they will talk about, you know, women on the side, and, you know, there are different belief systems that are out there, and the other men, they would rather just laugh about it or high five or whatever than to say, hey man, that's wrong. Like, you have a wife, or, you know, that's wrong. You got a daughter, or what if somebody treated your niece that way, or whatever the case may be. You don't really hear a lot of that accountability within, you know, exclusively male groups. And so I would take on a whole barbershop, like me versus them, you know, debating these issues, because I'm there and I'm listening to it. But I do see a pervasive lack of accountability, and this is a stereotype and a generalization, but in my experience, I have seen a lack of accountability within men groups. Now, if there are women mixed in, the tone changes a little bit if they're in a different setting, but if there's like a man cave or a safe space for men, like, they do not hold each other, you know, to the fire. So men do need to do more of that.
And one thing I've noticed is that if you do happen to peek in and say something, you just can't get a joke. That's what I get sensitive. Yes.
Well, I mean, like I said earlier, I grew up with 4 sisters, my mother, and I have 3 daughters. And so for me, you know, I've always seen things differently, just based off the way that I grew up, and that's translated into the way that I father and the way that I approach issues, right? And so yes, I am countercultural. I am that guy, just because that's just how my mama raised me. You get what I'm saying?
Good mama.
Good mama, right? And then, you know, even to some extent, you know, it's I'm fearful for my babies.
All right, well, I'll give everybody a minute to do a wrap up, some closing remarks. You can tackle whatever subject. But now, I know you said you just moved to Mobile to meet all some friends. I'm putting you on my Infirmary friends list.
Yeah, this was very good. Mr. Jones, thank you for being so transparent, because we have to be careful for our children. That's why we do the work we do. So we don't have to be in front of go to Whispering Pines or whatever the cemetery is to see our own children be lowered to the ground. That's why we do what we do. That's why we fight. That's why we're here. When I have 40 when I saw 46 patients today, I'm like, I gotta come here because this is necessary. This is what maybe one day will curb violence, for our community. And I think about, like people say when something happens, oh yeah, you're my thoughts and prayers. There's a book that, it says, for colored girls who have considered suicide when a rainbow isn't enough, where it says, I don't need your sorries, because I got enough sorries that meet me at the front door. Basically, I don't need your thoughts and prayers. Fannie Lou Hamer says that you can pray until you faint, but until you work and do something, until you get up and do something, then it means nothing. And so I implore everyone to do something. My white ally friends, I thank God for you, right? Because it's breaking the silence. That's what we're here for. We're breaking the silence. Come to my church, I come to your church. Let's break out this the 11 o'clock segregation hour on Sunday morning. We can mingle together on the fourth Sunday or fifth Sunday. We have to break the silos within our community, because once we figure out that gun violence is just as important as fentanyl overdose, then I think we'll move something.
Yeah, I'll say I've been really concerned about the lack of permits from domestic violence. I think, it's really scary, and so many people just don't seem to see that.
Well, I just wanted to say that in this space where it can feel like, we're like running the opposite way down or up the escalator, like we are pushing against the tide, we have to continue to do that. Like, I know that it would just be probably easier for us to go to places or states where there is, gun legislation that, keeps our children safer, or there are laws that say that women have a right to choose what's best for their own bodies. But if we leave, then who is here to fight, this fight? And I take that responsibility personally, and everybody on this stage with me, I think I can honestly say we all take that responsibility personally, and it's difficult and it's inconvenient, but we have to push in and push forward towards progress. And I think, it's easy when you can walk like in the direction of the current, but to fight back against opposition at every level, when it comes to keeping us safe, when it comes to choice, when it comes to children who will never go to their senior prom, when it comes to all of these things that we would like to see better and different in our communities, it is us. And, there's something in us and something that we see uniquely, for each of us individually. For me, it is the opportunity for my son to grow up and not be afraid of life. I'm into animals because he's into animals, but sea turtles, only 1 out of 1,000 of them make it from the egg to the water, because there are so many different variables that can take them out from when they begin to waddle all the way to the water, which is probably usually about 30 feet away. But all of those things that can take out our babies, whether it is a fentanyl interaction, whether it's gun violence, whether it's a gun accident, whether it's a gang-related issue at a skating rink, and he didn't do anything to anybody, just wrong place, wrong time. I put that in quotation marks because I don't think there's such thing. We have a right to be where we are. But when we want to protect our children from these variables and all these things that can take them away from us and make our communities safer, not just for our children, but for all children, because these are the humans that my son will interact with. And so I want them to be alive, well, and whole, so that they are good people for him to be around as well. And so we have to be those change makers. Like, we have to be the change that we like to see, and that's another reason, not to bring it back to the race, but this is like the most proximate thing on my mind. That is why I got into the district attorney's race, because if you don't like how a certain lane is moving, if you don't appreciate how a certain leader is leading your community, then it's you. I mean, it's you. You have to be the one to stand up, and for what we like to see in our community at every level and in every branch of government, is us. And so I'm thankful to share this stage with y'all's varying passions and professions and loves and fears. Like, I'm just happy to share the stage because I know that we can all tackle it together from different angles. So I appreciate it.
That was great, Moshae. Yeah, I grew up in Green Bay, and I sometimes really feel hopeless and want to go back to the West Coast, but I was driving through Green Bay today and just cried, thought, and said, like, in the car, I will not leave y'all behind. Because I was that little girl in Green Bay who didn't know any better, and now I do. And so I want to help other people know and do that.
That's right.
What about you, Mr. Jones?
What's that?
Do you have any closing remarks? You and my husband are going to go along because I don't know if y'all heard what he said he needed a break because he got emotional. My husband is a big old teddy bear too.
I always drop a bucket of tears and that's it. Especially when it comes to my babies. But I'm 6 years law enforcement here in Mobile, 11 years total military. 3.5 years with the Secret Service, and I came back here from the Secret Service to do what I'm doing. Because to be in a place to where you have the opportunity to make a change for the next generation, and when I speak about the next generation, definitely the three faces that pop in my eyes or in my head is my babies, right? For the next generation, how could you say no? To opportunity as such, right? And so to be here, to be in this place, to be able to stand shoulder to shoulder with individuals like Dr. Ford Johnson, did I say that right?
That's it.
And Ms. Moshae, Donald, and Devin as well, I'm grateful for the opportunity. But what I've been saying since day one, it takes all of us, but we need more. We need more of y'all that are willing to step outside of your comfort zone and mentor these kids. We need more of you that are willing to step outside and come with us into these schools, talk to these kids, go into these communities, identify the issues in these communities and meet them where they are, right? It's not going to change until we decide to get up and make a change. And they don't know any better. We gotta still take it like that. They don't know any better. They're still kids, right? They are acting out on what we allow to be perpetuated in our communities, right? They are taking advantage of what we allow to go out into our communities, right? So we have to be able to stand up and declare that all that's done, it's over, right? And we gotta move on that. And one of the things that I was saying, telling a couple folks a couple weeks ago that I thought was really amazing, man, is that the way that we've approached dealing with these kids has been all backwards, right? Growing up, it was do as I say, not as I do. Why? Because that's what Mama said. She said, that's it, right? Nowadays, and these kids have access to so much information at their fingertips, right? We have to treat them as such now. We can't dictate to them what this will be and how this will look anymore, right? We can't dictate to them because they have so much access. They can challenge what's being said outside of our mouths now, right? So we have to treat them as individuals, young adults with minds that can make informed decisions because they have the information. We got to negotiate with them now in the way that we approach these issues. And once again, I said it earlier when we was talking about the woman issue, the women issue, the abortion issue, is I refuse to be a part of an organization that makes decisions on behalf of the community that's not present at that table. We need to get these kids in a position to be able to speak truth to power. And we got to be able to stand behind them when they do that, right? And that's going to take us. That's just going to take us. We got to put them in a position, empower them to occupy adult-dominated spaces and speak truth to what it is that they know that they need in their communities, and we can bring that to fruition. So I'm thankful to be here tonight. I look forward to future opportunities to share and engage with you all. Again, thank you for sharing the stage with me. Y'all two beautiful black powerful women. Miss Ford, you are a beautiful soul, and me and your husband, we will be crying and watching the notebook together. And it's okay. It's okay. Just bring us some Oreos. You know what I'm saying?
He loves Oreos. Yeah, I did love what you said about empowering kids, and
That's right.
one of the things I've noticed is just treating them with love. I saw a little boy throw something out of his car the other day, and I pulled up, I was in my minivan, and he thought, I saw he was like, oh, and I said, son, I said, pick that up, you are so much better than that, you're a great kid, why did you do that? And then he started smiling, because I didn't like yell at him and say, you're a piece of trash for doing that. I said, you're a great kid, why would you do that? You know, and he left smiling from the interaction. So it really just approaching kids with love instead of condemnation. I think so often adults just treat kids like dirt and like they don't know a thing. And I can tell you, my daughters teach me things all the time. I'm just amazed at their wisdom and the way that they view the world. So I love that you want to empower kids, and I think that's what we need to do. Any further closing remarks or questions? Well, thank you, everyone, for being here, and the promotion on November 8th, and other amazing candidates who are going to help us come up with some solutions to these very